This weekend, thousands of Tennesseans and, of course, millions across this nation are going to pause and give thanks for our veterans. And quite frankly, this is something that we should be doing every single day. And I just am amazed and so grateful that, Madam President, there are men and women like you who have worn the uniform, who have served, brave men and women who wake up every day in some of the most dangerous places on the face of the earth, and you do a job that would bring many of us to our knees. We would look at this and say, it is basically impossible. And when our veterans have done their part and they come home, they find themselves facing another set of struggles. The challenges the veterans face are well documented, and we hear about them. Long waits and long lines at VA hospitals and clinics, long recoveries from battle wounds that they have suffered, and severe emotional and mental health struggles that, if left untreated, those could end in tragedy. There are systems in place to help our returning heroes. We just need to be using these correctly. Earlier this year, the VA OIG, Office of Inspector General, released a report showing that the agency's system for keeping track of controlled prescriptions had almost entirely broken down. Now think about that. We're in the middle of an opioid crisis in this country. There is a system in place, but the VA's system for keeping track of this, of all of these prescriptions, had almost entirely broken down. This is truly unacceptable. And pretty much what was happening is this. The state-operated prescription drug monitoring programs, or PDMPs, contain valuable information about what drugs veterans are being prescribed outside of the VA healthcare system. VA clinicians are supposed to check this database before prescribing opiate-based and other controlled medications to make sure that their patients, that patient in front of them, that veteran in front of them, is not receiving too many pills from multiple sources. Now get this, that Office of Inspector General report, the OIG report, showed that 73% of our VA patients who were prescribed opioids walked out of the pharmacy, medication in hand, without a VA clinician ever having performed the minimum required checks. So the system is there, it could be utilized, but what happens? The clinician gives the prescription but never checks the database in 73% of the cases. This failure to follow through put 19% of those patients at risk for problems with their care coordination. And almost half of those VA patients were under long-term care for chronic pain and were at a higher risk for opioid use disorder and overdose. We hear about these reports time and again, and we say, how in the world could this possibly happen? How could this be acceptable? And it's not. And we look at how it happened, and here's what we found out. It happened because the VA didn't make the rules clear enough. Officials highly recommended, get this, they highly recommended that clinicians submit a PDMP query, but they didn't explicitly state that it was required under existing VHA directives, and there were no national oversight controls to act as a backstop. So the rule is there, but a bureaucrat, a clinician says, well, they recommend it, but it's not required, so I'll skirt that. Along with their report, the OIG handed the VA a laundry list of recommendations, including directives to develop national oversight programs, better train their clinicians, that one should be an imperative, and embed accountability checks into the technology used to track patient care. VA officials have submitted now approved corrective action plans, and we thank the VA Secretary for this, and it's our job to make sure that they do follow through with this. The lack of organization that turned VA clinics into unwitting pill pushers has made it almost impossible for veterans to seek help during times of mental and emotional distress. In September, the VA published a report that confirmed our worst fears. As of 2017, there has been no significant change in veteran suicide rates. In 2017, the suicide rate for veterans in Tennessee hit 32.6%, which is significantly higher than the overall national suicide rate. It will take more than one day of recognition to fix this. It is going to take commitment and an all-hands-on-deck approach. I'm an original co-sponsor of the Improved Wellbeing for Veterans Act, which will help vets connect to the over 50,000 existing suicide prevention programs that are ready and waiting to be helpful. The bill will also give regulators a tool to measure how effective these programs are. It's a good start. It's not enough. Earlier this year, President Trump launched the Prevents Initiative, and we thank him for this attention to the needs of our veterans. Prevents established a cabinet-level task force responsible for finding the root causes of disconnect between veterans and helpful services from the VA and private organizations. Their job is to develop a strategy for federal, state, and community leaders to engage with veterans, improve research and access to resources, and work from the ground up to prevent suicide. Here's the caveat. This will only work if we remain in constant contact with veterans back home and use those interactions to find the cracks that veterans continue to fall through. You know, Madam President, for years, we've listened to frustrated complaints from agency officials insisting that untangling the VA's procedural knots is an exercise in futility. Sometimes you hear, well, it just can't be done. We do things this way because we have always done things this way, and that's not necessarily true. We do them because oversight has not been exercised. But it's time for all of us, not just lawmakers and rule makers, to finally accept that honoring their service, honoring the service of these heroes means helping these heroes heal when they need it and not leaving them at the mercy of a broken and bloated bureaucracy. I yield the floor.